Hi, so with an autoimmune condition, exercises should be carefully done as to not cause catabolism or breakdown of muscles. When exercise intensity reaches a person's threshold tolerance, the benefits diminish due to increased inflammation that can cause minor setbacks, and you don't want that. This was the case for me personally when going through a flare, or just before and after the flare. The aches and pains are a normal part of living with autoimmune condition, but this shouldn't be the reason why you don't move. Muscles are the largest organ in the body, and they are commonly taken for granted. When the body is inflamed, the muscles and joints tighten to guard themselves because of the pain that sends signals to your brain. The best thing for this tightened state is to gently move the inflammatory chemicals out of those areas and to allow the body to metabolize and detoxify. Too often, due to pain, lupus or other autoimmune patients are reluctant to move, but it's particularly important to move safely, especially during those times. If not used, our muscles can atrophy or shrink fast. And when our muscles are weak, our joints are not protected from injury. And our bodies are designed to move, so it's best to keep moving those joints to retain muscle integrity, decrease inflammation, improve mobility, strength, balance, and decrease pain. So today, I want you to join me for a quick movement therapy incorporating yoga, Pilates to learn to activate your muscles and move to help your body heal. Hey everyone, so today is going to be all about mobility. Whether it be yoga, Pilates, whatever you practice, we're doing movement because our bodies are designed to move. And a lot of the times when we live with an autoimmune condition, because of the aches and pains, it seems like it's a better idea not to move. And I see a lot of patients doing that, but I want to prove you wrong. We want to be moving to move those inflammatory chemicals that tend to like our joints to kind of be flushed out. And how we do that is by moving our muscles. Our muscles are able to contract and relax through the vessels all throughout our body. Through the veins and the arteries, it kind of circulates all the blood throughout the body. And so the more we can circulate, the more we can pee it out, all the impurities out of our system, the better off we'll be. So it's actually anti-inflammatory to be moving. But the question is, we don't want to do too much, or we don't want to do too little. We want to be building muscles enough, but not taxing too much to cause catabolism. We wrote about this today on our blog, and I explained this in the prior video or the earlier on. So let's just talk about our joints, right? Our spine is the most important. For that to be stable, what we want to do always is go in the direction of defying gravity, which means we want to have a decompressive effect in our spine. How we do that is to learn how to engage your core. So I want you to place your hand right below your rib cage and just kind of palpate and see if you can go under that rib cage to see if there is any push. If you can really push and feel into your stomach, that means you don't have the muscular stability or activation. That specific muscle is called the transversus abdominis. It's part of the core musculature that I help you to fire. And that muscle goes from the rib all the way to our pelvic bone. It's almost like a fascial layer that goes, and it's the deeper part of our abdominal musculature. It needs to activate first. That means it needs to fire first. There's this concept from our brain to our muscles. That's the neuromuscular connection. And then how we move our body is from the musculoskeletal connection. So it's a two-part connection that needs to be whole. So I want you to just palpate to see if you can feel it, right? How you can learn to see if you're doing it, I usually teach my patients on their backs. I help them have their knees bent and inhale as you arch and exhale, tuck and scoop, and it really exaggerates this arching of the back and really flexing of the spine, like you're pushing the small of your back down onto the mat and inhaling, arching, and exhaling, tucking, right? This way. And I want you to just inhale up. As you exhale, I want you to be mindful of pulling the rib and the pelvis together, and you're feeling the muscle activate. It's not like a contraction, like a hard pull. It's like a gentle corset-like activation where it starts to draw the navel to the spine without pushing things out. So inhale and exhale all the way down. Why this core musculature is super important is because this sets the tone, and it's the very stability that you need to do everything that you need to do. So even in a seated posture like this, I want you to place your thumb under the ribs and then maybe the pinky finger on the top of your pelvis. And then go ahead and inhale. And then feel that expansion of the pelvis being pulled away or the rib being pulled away as you take that inhalation, as the excursion of your ribs to take the air into your lungs, it expands. And then when you exhale, exhale through your mouth like you're fogging a mirror. Until you can't go anymore. When you really use your breath and really suck that last breath out of you, that's when you can really feel those inner muscles kind of contract. Why I want you to exaggerate and learn about how that works is that's a very good way for you to connect with them, because I promise you, most of us, me included, maybe 15 years ago when I started up Pilates, I had no transversus abdominis firing whatsoever. I had just had my first boy. My son was born a year before when I picked up Pilates. Like, there was no musculature. Not only that, I had diastasis recti, which meant a separation of my fascial layer. So that's the most important thing. And I want you to kind of sit nice and tall. This is called the Sukhasana position. However way you need to sit is fine. You might want to elevate your seat with like a pillow to allow for more mobility in the hips. But we want to increase mobility because at the end of the day, I want you to be able to independently move through space, do whatever it is you want to do, because anything's possible. Even with lupus, all the pain can be gone. You can be as fit and active as possible. And I want that version of you to live out your life, not let you deteriorate and lose integrity of your muscles and its function. So keeping that in mind, sitting up nice and tall, imagine your spine at the center of your pelvic bowl, sitting up nice and tall. I want you to, in this seated nice tall posture, I want you to bend your neck all the way down. And then I want you to roll it to the right, all the way up, and roll it to the left. And many of you, if you have issues with the neck, cervical spine and such, this might be very difficult. Like, I have a little bit of a kink when I go this way. And I feel those, a little bit of a pinching sensation. It's almost like your body's trying to guard these little points where inflammatory chemicals reside to limit motion. You don't want to let it do that. So you want to make sure the more you can move, the better. So if that hurts you, like, see, when I go this way to the left, this feels like a pinching sensation. It's been bothering me since a couple of nights ago. So I want to work that out. So I'm going to go side to side. I'm not trying to activate and irritate my neck so much, but I want to move through it wisely, being very mindful of the receptors and the sensation of pain that's coming at me. Naturally, if I'm not knowledgeable enough, I'll listen to the sensation and I'd be so scared to move. So if that's you and you feel restricted in the neck, all I want you to do is maybe bring your ear to the right shoulder, and then stretch on that side. Maybe that's all you can do today, but know that this motion is available to you. And come all the way up and go all the way down. Because what happens is, a lot of the calcification, when you don't move, things get rusty, just like anything else. Our bodies are the same. And when you get rusty, we get calcified, things lock up. And so I see a lot of patients who lost mobility in their neck to a point where now they can't really rotate their neck anymore. Look at your parents, if they're older. A lot of them are so hunched back, they have limited range of motion to rotate. But when you're opened up and properly aligned, look what my neck does. Goes all the way. And so I have 360 view of my whereabouts from my range of motion in the neck. And I want to make sure I maintain that range. Same thing, right? So the neck, we talked about how it flexes, it looks up, and then it turns, and then it side bends. So you want to make sure you retain and maintain those muscles. And then next is our shoulders, right? We can go all the way up, and then we can go all the way down and all the way to extension. And then we can go out to the side all the way up and down. And then we can even go circular motion all the way up and down. But you have to be seated nice and tall to do this, because if I'm slouched, I have limited range of motion everywhere. So you want to make sure you're properly aligned to allow full range of motion. And you never want to compromise or have your motions compromised in any way, any of your joints. Here's my hands. Make a big tight fist and out. Tight fist and out, right? Just kind of notice what your hand's able to do. Flexing at the wrists, bending at the elbows, right? You want to make sure you're doing that and see what muscles, can you make your muscles kind of do that motion is what I want you to do. Come quickly on your hands and knees. I want you to do, dump your belly all the way down, gaze up, shoulders drawn down. Exhale, tuck your tailbone all the way down. See if you can do this by pulling your navel to the spine, really activating your core musculature, pushing your hands down firmly through the mat, almost like bringing the forearms closer together as to activate the whole length of the arm. So sink your belly, gaze up as you inhale, tuck your tailbone, really pull the navel to the spine. Work out your muscles, feel the muscles on the backside of your pelvis, backside of your spine, your neck muscles, your abdominal muscles, your shoulders, your hands. See if you can make that happen. You want to make sure that that mobility is there, right? And then from there, let's push back into downward dog. And if you can't do this because of your hand injury or what have you, see if you can, first of all, if you can do this, see if you can push the floor away and then keep your knees bent, because most likely your hamstrings are limiting your ability to sink your heels down. So you want to alternate bending side to side. But I want you to push, push, push. Feel the stretch in your low back first before you even think about lowering your heels down. So that's one. And then from here, are you able to come onto your knees? And then from here, can you come and from this position, come all the way to standing? Because a lot of the times you can't go from standing to a seated position without a lot of the times people are looking and then they have to have their hands down first and then they have to kind of go down like this because they have limited ability to bend and straighten their knees. This is full range of motion. A lot of people, when they lose range of motion, even in the bend and extend, and that doesn't have anything to do with the flexibility, you should be able to have full bending and extension of the knee. So I want you to, if you have that ability, practice that every day. Just go through those motions and learn what they're all about. And then see, seated this way, see if you can put your toes out and toes in. Toes out and in. And then that's going to really flush out the muscles and the joints in your hips. Okay? Do that. And then bend. And then learn how to keep your feet down. And then see if ultimately you might want to hold on to something initially, but can you come from this position to standing? Are you able to go all the way down? Because we used to be able to do such things when we were younger, but as we get older, especially with lupus, we stop moving. We're seated all the time. We're lying down all the time. We don't move. We become sedentary. We forget that if we don't use our muscles, we're going to lose them. So I want you to practice doing that. Just play with all the muscles in your body. From the wrist, elbows, like I said, the shoulders, the neck, and then from the knees to the hips, See if you can do all those motions. And every week I'll give you some tutorials on how to move better in some way. I'll go live on Facebook, or if you have requests about what movements you want to improve, then you can write to me about that on our Facebook page as well as on our YouTube channel as well. And on our Dr. Connie G on YouTube channel, there's a list of yoga videos that we've been doing for many, many years. For at least 2 years, we've been consistent. So we've been putting up a yoga video every time. So go dig there to see if you can start to move, and I please encourage every one of you to start moving today to maintain your mobility and retain your musculature. I'll see you guys next week.